Please be seated. Good afternoon, everyone. I am Bruce Keppen, and I have the great privilege of serving as the Dean of the Frank H. Netter, MD, School of Medicine at Quinnipiac University. I would like to welcome our students, their family and friends, the faculty, representatives from our affiliated clinical institutions, and guests to the White Coat ceremony for the members of the class of 2018. Before we begin, I would be remiss if I did not acknowledge and recognize some of the many people who have helped us get to this day. First, I would like to acknowledge the institutions that will be helping to train our students. Our clinical education partners are St. Vincent's Medical Center. They are our principal clinical partner, and I am pleased that today the CEO, Dr. Stuart Marcus, and their Chief Academic Officer, Dr. Mitch Fogel, are here for the ceremony. In addition to St. Vincent's, we have educational affiliations with Connecticut Children's Medical Center, Gaylord Hospital, Griffin Hospital, Jewish Senior Services, Masonic Care, Midstate Medical Center, Middlesex Hospital, Waterbury Hospital, and a large number of private practice physicians that precept our students in their offices. We also have research partners, the Connecticut Agricultural Experiment Station, Hartford Hospital, the Weitzman Quality Institute at the Community Health Center, and Qualidyne. At this point, I would like the faculty of the School of Medicine, both those on stage and in the audience, to please stand and be recognized. Would our administrative staff please also stand? And I would like to acknowledge Dr. Mark Thompson, the Executive Vice President and Provost of Quinnipiac University. You can be seated. Thank you. Dr. Sam Parrish, our Dean of Students, and Anna Sprague merit special thanks for organizing all of the week's orientation activities and especially this ceremony. And lastly, I would like to recognize the individual whose vision and leadership is responsible for the creation of the medical school and really all of what Quinnipiac University is today, President John Leahy.
Thank you. Good afternoon, ladies and gentlemen, and a special welcome and congratulations to the newest class of the Frank H. Netter School of Medicine. We received over 5,200 applications from across the country to fill the 90 seats in this class of 2018. Our School of Medicine selected 90 of the very best and the brightest, and I may add a very diverse group of medical students. Many of you have had prior careers in health-related fields, but this class also includes a lawyer, 2 professional actors, a director of film photography, and several who have served previously in the U.S. military. As you well know, the United States is greatly in need of more practicing physicians in a wide range of primary care and specialty areas. Unlike more research-oriented medical schools, the Frank H. Netter School of Medicine at Quinnipiac University is absolutely committed to educating the next generation of practicing physicians. Your unique backgrounds, superb academic achievements, and personal commitment to the practice of medicine make all of you ideal candidates to help serve the healthcare needs of our nation. And I might add that you'll be entering the medical profession at one of the most challenging, exciting, and transformative periods in the history of health and medicine. Looking out over this very talented, and I might say very young group of new medical students, I can't help but be impressed and optimistic about the future of healthcare and medicine in America. Quinnipiac University has and will continue to support the Frank H. Netter School of Medicine to make it one of the very best medical schools in the country. I have no doubt that each of you in the class of 2018 will leave a mark on our medical school. And I believe you will leave an even greater mark in the future and the profession you're entering. Again, my congratulations and best wishes to each and every one of you.
Thank you, President Leahy. I would like to take a few minutes to address you, the members of the class of 218, and then also your family and friends who are here with you today. To the class of 2018, congratulations. I know you worked long and hard to be sitting where you are today. As Dean of the School of Medicine, let me be the first to welcome each and every one of you into the profession of medicine. As you heard from President Leahy, you are an elite group, having been selected from a pool of over 5,200 applicants. What lies ahead for each of you are 4 years of exhilaration, excitement, learning, and of course, hard work. As you assimilate into the Netter family, I would ask that you commit yourselves to the principles of conduct, our principles of conduct, which are compassion, duty, honesty, integrity, respect, and professionalism. These principles should guide everything you do and every interaction you have, whether with your classmates, faculty, staff, and especially patients. The faculty of the School of Medicine have developed what we call a compact between faculty and learners. I would like to share a couple portions of that compact with you, as I believe it sets the stage for what lies ahead when classes begin next Monday morning. First is the commitment the faculty make to you. They strive to ensure that all components of the educational program are of the highest quality. I can assure you that the faculty have prepared for you a phenomenal learning experience. As your teachers and mentors, they will maintain the highest professional standards and treat each and every one of you with respect. They recognize that personal wellness is important, and so will support your need to have sufficient time outside of class to fulfill personal and family obligations, engage in recreational activities, and obtain adequate rest. Most of all, they are committed to creating an environment that nurtures your personal, intellectual, and professional development. You too are expected to make a commitment to the faculty. You are expected to do your best to acquire the knowledge, skills, attitudes, and behaviors to fulfill the competencies and educational objectives the faculty have established. You are to do this in a collegial manner with your classmates. You are not here to compete against your classmates. You are here to learn and to help them learn. Today, medicine is a team sport, and you must start behaving as a team member. Above all, you are expected to bring honesty, integrity, and passion to your studies. Again, congratulations on being a member of the class of 2018. Your journey begins today. Your time with us will pass quickly. Just be sure to enjoy the journey. Now to family and friends. Be proud of your special member of the class of 2018. They sit before you today because they have achieved much. But I know, and they do as well, that they did not do it alone. They had your love and support, especially during the hard times. Please don't consider your job as being finished. They are still going to need your support and love because they still have many challenges ahead. So continue to be there for them. Sometimes it takes just a phone call or even an encouraging text message just before the big exam. Be there for them and start getting ready for the day they complete their journey and walk across the stage at commencement to receive their diploma. Be there so that you can proudly call them doctor. Thank you. I now call Dr. Stephen Weichel to the podium. Dr. Weichel is a Senior Associate Dean for Scholarship and Chair of the school's Department of Medical Sciences. He also holds the school's first endowed chair, the St. Vincent's Chair of Medical Sciences. Dr. Weichel will provide a brief history on and significance of the white coat as a symbol of medicine.
The white coat ceremony was developed by Andrew P. Gold, MD, at the Columbia University College of Physicians and Surgeons in 1993. Dr. Gold's objective was to bring a humanistic focus to medicine, He believed that a physician's responsibility is not only to take care of patients, but also to care for patients. The white coat ceremony is an integral part of the institutional practice of medical schools in the United States and around the world. The ceremony takes place in 96% of medical schools within the United States, and the Arnold P. Gold Foundation designed the white coat ceremony to help entering medical students establish a psychological contract for the practice of medicine. The ceremony in which you're participating symbolizes that throughout your life, you need to be emphasizing the importance of compassionate care for your patients, as well as achieving the scientific and clinical proficiencies underpinning the practice of medicine. You may be surprised to learn that until the 1800s, physicians dressed in black. An excellent representation of physicians of that era engaged in clinical care is the 1875 masterpiece by Thomas Eakins entitled The Gross Clinic, in which Dr. Samuel Gross and his assistants are all wearing formal black attire while performing an operation. Black attire to this day still is considered formal. Medical encounters were considered to be both formal and serious interactions, and likewise, clergy of that era wore black to reflect the solemn nature of their interactions with parishioners. Until the latter part of the 1800s, interactions with physicians were often not particularly beneficial to the patient and frequently were associated with impending death. Resulting from his awareness of the writings of Louis Pasteur, Sir Joseph Lister, professor of surgery at the University of Glasgow, is recognized for the introduction of phenol to sterilize surgical instruments and to clean wounds, resulting in a dramatic reduction in post-surgical infection. Implementing antisepsis contributed to the movement of medicine to a science-based discipline. The importance of antisepsis and the bioscientific foundations of medicine were further advanced by the publication in 1892 of Sir William Osler's textbook, Principles and Practice of Medicine, which became a standard for many decades. Carnegie Foundation Bulletin Number 4, the report by Abraham Flexner, published in 1910, resulted in sweeping changes in medical education with the restructuring of medical education around laboratory practice. Cleanliness and antisepsis became core tenets of medical practice. The pureness and cleanliness of medicine was reflected in the white attire of physicians and nurses. The nature of that transition is evident in another painting by Thomas Eakins entitled The Agnew Clinic, which was commissioned by the University of Pennsylvania medical class of 1889, painted 14 years after the Gross Clinic. Dr. David Hayes Agnew, the famous anatomist and surgeon, is wearing a white smock, his assistants are attired in white, the nurse is wearing a white cap, and the patient covered by a white sheet. The white coat continues to be a symbol of medicine. It symbolizes knowledge, compassion, and honor in the doctor-patient relationship. The white coat also can be intimidating. Pediatricians and psychiatrists often prefer not to wear a white coat to reduce patient anxiety, and white coat syndrome is a widely recognized phenomenon in which elevated blood pressure occurs in the clinical setting but not elsewhere. Dr. L.D. Lewis stated in the White Coat Keynote Address at Columbia University in 1994 that the white coat is viewed by patients as a cloak of compassion and a symbol of the hope and caring that they expect to receive from their physicians. Sir William Osler said the practice of medicine is an art, not a trade, a calling, not a business, a calling in which your heart will be exercised equally with your head. As you begin your medical education, many of you are likely feeling a mixture of emotions that include anxiety, apprehension, excitement, and anticipation. You're entering a dynamic profession, and your careers will be marked by spectacular scientific and clinical advances. As you don your white coat for the first time, reflect upon the core values it symbolizes and that will guide you throughout your life: scientific and clinical competence, and the highest standards of professionalism, compassion, honor, integrity, and trust. You are embarking on a wonderful journey that will touch many lives in countless positive ways. Thank you.
Thank you, Dr. Weichel. Dr. Michael Ellison, the Associate Dean for Admissions, will introduce our keynote speaker.
Good afternoon. I have the pleasure of introducing our keynote speaker for this white coat ceremony, Dr. Kristine Lisi. Dr. Lisi graduated from the St. Joseph High School in Trumbull, Connecticut, where she received the Alumni Award. She earned her Bachelor's of Science degree in biology from Fairfield University, where she was on the dean's list for each year. That would be great if we were reviewing applications for medical school. And she earned her Doctor of Medicine degree from the Medical College of Pennsylvania. Dr. Lisi took her residency training in internal medicine at the University of Massachusetts in Worcester, Massachusetts, and joined the faculty of the University of Massachusetts as an instructor in the Department of Internal Medicine. In this role, Dr. Lisi demonstrated her skills as a teacher, receiving the Award for Excellence in Education from the Massachusetts Memorial Medical Center. Dr. Lisi served as a primary care physician in practice for several years and joined the faculty of the Frank H. Netter MD School of Medicine in 2011. She has been the recipient of the Patient's Choice Award twice and has been recognized with the Compassionate Doctor Award from St. Vincent's Medical Center. She has received the Distinguished Medical Educators Award, and this year, she was named Teacher of the Year by St. Vincent's Medical Center. Dr. Lisi is active in the American College of Physicians and the Ethics Committee at St. Vincent's. She serves as the faculty advisor for the Internal Medicine Interest Group and is currently the Internal Medicine Clinical Education Coordinator for the Frank H. Netter MD School of Medicine. She holds the title and responsibility of Medical Director of the Family Health Center at St. Vincent's Medical Center. When our student orientation panel was asked to nominate a speaker for this white coat ceremony, Dr. Lisi was the first and enthusiastic choice. Our students cited her commitment to education, her dedication to the patients she served, and her energy and enthusiasm as characteristics they hope to emulate in their careers. Please help me in welcoming our speaker for the hour, Dr. Kristine Lisi.
Congratulations to all. Welcome to the students, faculty, staff, and friends and family who have gathered here to help you celebrate as you embark on your new adventure. I am so honored and humbled to be here introducing you to the beginning of your journey and introducing you to the first time of the donning of your white coat. What does the white coat represent and what does it symbolize? Truly, it represents healthcare and science. White in of itself represents cleanliness and purity. Your white coat represents knowledge. It represents professionalism. It says, I am here to help you. It says, I am here to educate you. In some patients, it may initiate an emotion of fear. In some cases, a feeling that the person in the white coat has arrived. It can be a barrier. The white coat becomes a container of just stuff. Just wait until you see all the stuff that you will fit into your pockets. You will be amazed at the reference books and guidebooks, tools, keys, etc., that you fit inside and the outside pockets. But for most of you, the white coat says, I have arrived. We can teach you science. We can give you tools for knowledge. We can encourage you to perform self-directed learning. We ask for you to solve problems. We have you follow a template for the history and physical on a patient. We ask that you give us the normal and abnormal exam findings. We ask that you report the objective lab findings. We ask that you give us a differential diagnosis. We ask you your treatment plan for the patient. We then have you relay our plan for the patient while we observe you give the plan. But did you notice that all of this just said was purely objective and can be done with no emotion? Almost robotic in nature. There's an entire part of medicine that no one can teach you. It is what many refer to as the art of medicine. So what I'm really saying is that your white coat symbolizes many thoughts and emotions from those who wear it and those that see it on your person. Believe it or not, you define your white coat. The white coat does not define you. The definition that you give your white coat is what you bring to the art of medicine. A few years ago, I met a lovely patient who came to see me for a physical exam. She's a very healthy woman, a mother, a wife, a grandmother. We instantly hit it off. She would come in about twice a year, and we would just talk about our personal lives for even the first 10 minutes. We truly adored each other. But one day she came in, she said, "Dr. Lisi, I have back pain." She looked me straight in the eye. I knew by her expression and the look in her eyes that this was more than mechanical back pain that you would experience when you lifted a box. You see, the relationship and trust that a doctor and patient can have can be powerful. I knew what she meant. She was telling me something was wrong. She was hurting and she was trusting me to help her. Well, standard of care for back pain is rest, physical therapy, and Motrin. I knew that she was telling me that this was more than that. How did I know? I knew from my heart. Sometimes you just know by what the patient tells you by their emotion and body gestures. You just know by instinct. So I asked her a few more questions. A few red flag and alarming symptoms were uncovered. She had lost a few pounds unintentionally, which is considered an alarming symptom. Most of all, it was stopping her from the things she loved doing. And I teach that a lot in clinic. I always use that concept. If it stops a patient from what they love to do, that's probably a telltale sign there's a problem. So you will learn when back pain is associated with referred to as red flag signs, and in this case her weight loss, you need to work that up. So I did. And yes, the news was not what anyone would want to hear. She had pancreatic cancer. So after delivering the bad news, I needed to get her organized for her future care and help her find the specialist she needed and bridged her to the next phase of her disease. I did not see her much due to the nature and treatment that her disease needed attention for. However, I frequently called her during her course. I would just check in on her. She always had a fighting spirit, and she'd say, "Yep, I'm okay, Dr. Lisi," and I would call her again in a few days. This would go on for a couple of months. At some point in her care, she continued to get worse. The train was rolling, and I could not help her. Science could not help her. The most well-experienced doctors could not help her. So imagine that. All the science and medicine that we could teach and do research on could not help her. However, the art of medicine still can. I continued to call her. I called her husband too, just to check in on her. Then one day I got a call from her husband that she died. I told him what an amazing and inspirational woman she was and how fortunate I was to meet her. I gave him my condolences. But right before I said goodbye, he said, "Dr. Lisi, will you be around next week?" I said, "Sure." And he said, "Okay, I'll see you then." I hung up. So the next week comes, and I came out of an exam room, and the secretary said, "You need to go on your desk. Stan came by and left you something." I walked into my office, and on my desk were 2 potted bulbed plants and 2 books. In the book was a card thanking me for the care that I gave his wife. You see, it doesn't actually stop there. I called his cell. He had just left my office. I get in touch with him. I said, "Stan, thank you. Why didn't you stay? I wanted to give you a hug and we can talk some more." He said, "That's okay. You're busy." He said, "Esther told me, as she lay dying, that you have these books and these plants." Can you imagine how I felt at that minute? How powerful that moment was, how I could not stop her disease, and how helpless I felt that she was dying. I could not help her physically, but you know what? I helped her spiritually and mentally. I had no idea what impact that had on her, and you have no idea what that impact has had on me to this day. Think about it. As she lay dying, she thought of me. I will never forget that moment. And yes, those plants are still alive in my living room, and I see them every day as I go up the stairs, and the books are proudly displayed on my shelf in my office. So you can see that this is the art of medicine. This is what my white coat means to me. My job description is officially the medical director of the Family Health Center at St. Vincent's Hospital. So what do? I ensure that our patients receive proper medical care. I ensure that the logistics and system of the clinic are running at their best. I teach medical students and medical residents. But you need to understand what the Family Health Center is to understand what the mission and what my white coat stands for today. The Family Health Center is the clinic for the poor and underserved. These patients are truly the poor. Some are in shelters, some live in horrible conditions. They walk or can't take the bus because they don't own a car. They ration their medications because they can't afford them. Some chose between their medical care and food on the table. Some can't read or write in their native language, let alone in English. Some never finished grade school. A lot of them are the working poor, so taking time off from work to get health care means no pay, and no pay can mean no food or electricity. Why do I tell you this? Because my white coat in the clinic means not only that I can offer you care, but I am a compassionate human being, and I will work with you socially, mentally, and spiritually to ensure that you get what you need. Truly, I can spend you hours telling you stories about what you can do for the lives of people. I will just tell you one story that just happened a few weeks ago. Willie Mae is an 80-year-old woman who uses a walker. After months of not attending our clinic, she showed up. She was sent a letter that if she didn't come in, that we would no longer care for her. She is on Coumadin, and the agreement between the patient and a patient on Coumadin is to actually follow up regularly for blood work. She broke the agreement, and so she needed to come in or we could not be her doctor. So she came in. The resident presented her case to me. We made a plan for her Coumadin and how she was going to take it and have her come back next week. I said, Willie Mae, you understand that we need to keep you safe on Coumadin. We cannot take care of you. You don't come in here routinely for blood work. She said, yep, doctor, I understand. I said, okay, so we're going to give you the new Coumadin dosing, and I'll see you next week. She looked me straight in the eye and she said, nope, I'm not coming. And I literally stopped for a moment, paused, looked right at her and the resident who's in the room with me, and I said, you just said you were going to come. She said, I'm not coming because I can't afford the bus token, and that's why I can't get to see you. What a powerful teaching moment for me and the resident. My assumption was that she didn't understand the instructions of what we gave her. She truly didn't have the money to come see us. We now understood that her non-adherence was not that she was refusing medical care. It was that she didn't have the money to take the bus. Imagine that. She could not get there because the bus token was going to take her away from paying her bills and getting food. She said to me, I used up my last part of my Social Security check and I don't have money. We gave her the transportation tokens. Problem solved. This is what mission is all about. We have a mission at the Family Health Center at St. Vincent's Medical Center. We will provide medical care to the underserved and poor. But as you can see, our mission also includes taking care of our patients emotionally, spiritually, and mentally. This is what I ask you to do. Follow your mission. You will have the most exciting ride going through medical school. First, you will learn the medical knowledge that provides the background to deliver medical care. Then you will learn how it all comes together when you see the patients. You may deliver babies. You may be able to influence a person to lose weight to control their diabetes. You may be the person who holds the dying patient's hand until their family arrives. You may be the influence on a teenager to stay in school and away from drugs. But at the very core is that you are there and part of the team. You are there in your white coat. So as you don your white coat today, think about what it means to you. How do you see yourself and how will you define your white coat? I want you to understand that your white coat means knowledge and health care, but it also means goodwill and compassionate care. Think about what your mission is and pay it forward. Be compassionate, be a good listener, be an educator, be willing to accept feedback, be flexible, be a self-directed learner, be humble, be understanding, and be trustworthy. If you can do this, I am confident that you will be a great doctor. Just gonna go veer off. Long story short, I've been staring at Dr. Parrish's picture on the internet for the longest time. It turns out, literally, I wouldn't be here if it wasn't for Dr. Parrish, because Dr. Parrish was the one doctor that interviewed me to get me into medical school. So when people say I wouldn't be here, I really wouldn't be here if it wasn't for Dr. Parrish. Small world, actually it is. So thank you for this opportunity. Good luck and congratulations. Thank you.
Thank you, Dr. Lisi, for those inspiring words. We are now at the point in the ceremony where the members of the class of 2018 receive their white coat and stethoscope. Dr. Sam Parrish, Associate Dean for Medical Student Affairs, will lead this portion of the ceremony.
I'm thrilled to call the roll of the class of 2018, who will come up on stage and will be assisted in putting on their white coats for the first time by members of the teaching faculty. So the class of 2018. Eden Adilovich. This is a celebration, so let's hear it. James Ahern. Samia Alam. Rina Alcaldi. And Christopher Anderson. Jeffrey Anderson, Kayla Bassett, Alexander Berg, Kyle Bilodeau, and Robert Birch. Heather Boas, Michael Boncaldo, Benjamin Brink, Jose Omar Burgos, Jose Candelario, Gregory Chamberlain, Alexander Chen, Spencer Church, Justin Cole, and Ryan Cole. Now, yep. Brendan Comer, Katrina Crepano, Karen Dvolsky, Nathan Dembowski, and Megan Derbyshire. Anish Desai, Jessica Dodd, Jeffrey Erdman, Kristen Errico, and Rachel Feldman. Caitlin Ford, Danny Fu, Alexandria Georgia Dorellis, Corey Hassel, and Jet Cooper. Rebecca Howe, Scott Infusio, Sharwat Jahan, Evan Jamie Field, and David Joe. Andrew Camalaris, Jillian Caplita, Matthew Lavalle, Emma Lazarove, and Alexa Lee. Brannon Liang, Alex Lynn, Jessica Lothstein, Rose Lovell, and Kelly Lucchese. Jonna Luchetti, Van Mai, Samantha Mazetas, Lauren McNichol, and Darcy Moeller. Henel Modiwala, Miad Movasagi, Vilma Mucha, Janie Olson, and Avery Osella. Brendan O'Shea, Riddhi Parikh, Erica Parisi, Suman Park, and Dipesh Patel. Nicole Prendergrass, Daniel Kazi, Sarah Rahman, Ashkan Razmara, and Frank Ruiz. Zachary Rupp. Whoop. They'll get here. Zachary Rupp, David Schechter, Mary Schwert, Tyler Sherman, and Namjal Sherpa. Michael Soberai, Samuel Sondheim, Nicholas Spornick, Cameron Sprouls, and Dirk Stresser. Suna Summer, Paul Trebich, Yash Vaishnav, Sarah Vincent, and Ravi Wedasinha. And they're going to switch. David Whitehead, Eric Yu, Parma Zahid, Billy Lieh Zhang, and Yu Zhang. Don't they look great?
The class of 2018 will now be led in the Hippocratic Oath by Dr. Alan Atsuki, Senior Associate Dean for Education.
Could the class please stand? And could the physician faculty please stand? And I invite any medical students and any physicians in the audience to please stand and follow along. The Hippocratic Oath is on the last page of your brochure here, the agenda. So here's how we do it. I say a phrase, and then you repeat the phrase. All right? So let's start. I swear to fulfill to the best of my ability and judgment this covenant. I will respect the hard-won scientific gains of those physicians in whose steps I walk. And gladly share such knowledge as is mine with those who are to follow. I will apply, for the benefit of the sick, all measures that are required, avoiding those twin traps of overtreatment and therapeutic nihilism. I will remember that there is art to medicine as well as science. And that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I will not be ashamed to say, I know not, nor will I fail to call in my colleagues when the skills of another are needed for a patient's recovery. I will not be ashamed to say, I know not, nor will I fail to call in my colleagues when the skills of another are needed for a patient's recovery. I will respect the privacy of my patients, for their problems are not disclosed to me that the world may know. Most especially must I tread with care in matters of life and death. If it is given to me to save a life, all thanks. Most especially must I tread with care in matters of life and death. If it is given to me to save a life, all thanks. But it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play at God. But it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play at God. I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being whose illness may affect the person's family and economic stability. My responsibility includes these related problems if I am to care adequately for the sick. My responsibility includes these related problems if I am to care adequately for the sick. I will prevent disease whenever I can, for prevention is preferable to cure. I will prevent disease whenever I can, for prevention is preferable to cure. I will remember that I remain a member of society with special obligations to all my fellow human beings, those sound of mind and body, as well as the infirm. I will remember that I remain a member of society with special obligations to all my fellow human beings, those sound of mind and body, as well as the infirm. If I do not violate this oath, may I enjoy life and art, respected while I live and remembered with affection thereafter. May I always act so as to preserve the finest traditions of my calling, and may I long experience the joy of healing those who seek my help. May I always act so as to preserve the finest traditions of my calling, and may I long experience the joy of healing those who seek my help. Please be seated.
You're going to love this. Would you please rise? I present to you the class of 2018 of the Frank H. Netter, MD, School of Medicine. This concludes our ceremony. I would ask the audience to remain seated until the class of 2018 has exited, and then please join us on the other side of the curtain here for a reception. I would also ask that you allow the photographer to take the class photo before getting together with and taking pictures of your special member of the class of 18. Thank you so much for coming to today's white coat ceremony.